Hey, welcome back to the show. I'm here with Scott Schuster, longtime friend and colleague. Scott, thanks for chatting with me today.
Yeah, pleasure to be here. Thanks for having me on, Jared.
I do have a couple questions about digital patient experience in general, the digital experience and how it fits into marketing and healthcare. So, with that, tell us a little bit about yourself and we'll kind of go from there.
Great, thanks. I've had a really long and varied career, which I've really enjoyed. I've done investment banking, owned hair salons as a franchisee. I've done a whole bunch of different things, but what I've been doing for the last couple of decades has been more around operations, digital experience, strategy, marketing for health systems or vendors, consultants to health systems. I fell into it. I started out building websites for Chicago Health System, Northwestern Medicine. And that landed me into a permanent position there for a number of years and more focused on how do we improve digital access? How do we make the digital experience better? How do we make things easier on the health system and more accessible for the consumer, the patient?
If you look back at early career and some of the things prior to healthcare, do any moments stand out that kind of influenced your path that just kind of come top of mind, or like things that you think about of like, yeah, if that didn't happen, I don't know if I'd be where I am today.
I don't know if this answers your question or not, but there was a moment where I was deciding whether or not to go get my MBA or move to London and continue working at an investment bank. There's no doubt my life would be completely different had I chose the other path. I wouldn't have my family. I mean, everything would be different. And the reason I fell into healthcare is because I had wrapped up a role at a coal mining company that had been sold, and I needed work while I was finding my next thing. And somebody I had crossed paths with recently and back then knew about this opportunity to program manage the website redesign for Northwestern Medicine. So I knew nothing about healthcare at that point, but doing a hospital website, you learn a lot. It's sort of the 101 of healthcare to figure out what goes on the website, how they describe themselves, why they do that, what you can do on a hospital website or more likely can't do on a hospital website. I was very naive too. I was in my 30s. I wasn't engaged with, I was a healthy 30 something. So I wasn't engaged with healthcare, seeing a doctor outside of some urgent need in a long time. So I was super naive. I didn't know that the difference between surgeons and medical doctors, like where they sat in the pecking order at a health system. I thought all of them were equals. I don't know. Some may say they are, but if you've ever been in the politics side behind in the health system, they're not. Even though most are nonprofits, there is still a lot of watching of dollars and cents. And so if you're a rainmaker, you're a rainmaker. I don't think that matters by any industry, right?
Yeah, so true, so true. What are some of those other moments that kind of stand out when you kind of look back, like earlier in your career?
I think one thing that early in my career I didn't realize is that like I felt like I had to show up with answers when I started my career, and maybe I did when I was in investment banking or other things, right? Like I would show up with the 30 slide deck and try to get everyone to pay attention through all 30 slides to hopefully reach the same conclusion that I had reached beforehand. And what I found is that you really need to engage. You need to be a better listener. So I went from thinking I needed to come with answers to realizing I needed to come and be a great listener and then therefore like work with the person to get to a better solution, right? So if you're asking smarter questions, then instead of bringing answers, you're going to end up with a better solution. And that really did happen, especially as I evolved from just building the website into thinking about digital experience and how we can make things better. The other thing I would think about is you have to think about what the other person's motives are and how they think about problems. So at health systems, I said in marketing, I said in digital marketing, right? And so we had our own goals and objectives. And when you're trying to get anything else done with it, you usually need to find a champion in another group, right? That wants to do this. And they've got a totally different scorecard. And what they're interested in is probably not the same as what I'm interested in. So you've got to look for that alignment, right? Like the operations people are talking about throughput and scheduling access, and the clinicians are worried about the quality of care and burnout and things, that nature. So you have to figure out how the thing you want to do as a digital experience person aligns to those things. So how can I help you fill open slots on Thursday afternoon without needing to do a lot of phone call outreach, or, like how can my digital solution help you get to your goal? That was a skill I had to really learn, because people are really focused on their lane in the health system and they don't want to take on extra new projects in my experience. So you really got to lean into what are they getting evaluated on, and how can I make your life better?
But what if I kind of flip this and say when you've had the opportunity to share advice with those who are younger earlier on in their career paths about some of those things you just mentioned, you're talking about building credibility with operational leaders and clinical leaders, CFOs, even, the finance side, you're talking about champions in other organizations and they all have different scorecards. What have you shared with younger professionals as you've come along and experienced that yourself about how to do that, about how to build that credibility in the organization?
Again, I think it goes back to not trying to have the answers. It's asking better questions, right? Because you build credibility and empathy, right, by doing that, right? Like you're showing them that you're invested in what's important to them. Then taking that and executing on it and making their lives better creates a lot of credibility, in my opinion. I think not being afraid to not back down, right? Like not being afraid to say, I don't agree with that, even if someone's higher up in the organization than you, as long as you've got a reasoned point of view, if you can bring some data, especially in medicine, we do a lot of empirical evidence based learning in medicine. That's how these doctors are completely trained. So if you can show them data instead of having a bunch of opinions that we're now trying to wrangle down, you're focusing on the data. That's always better. Sometimes that was hard. I think it's getting easier with advancements in technology. I think that it's easier to get to some anonymized data, and there used to be some taboo about trying to capture some of that. There still is. There's lots of PHI concerns, et cetera. But I think
Sure.
it is getting slightly easier to get to some meaningful data now. And like I said, if you can bring data to the conversation, I think that's really important. And I think the other thing is asking for clarity, right? Like don't go
Oh,
off
yeah.
and guess. All right, this is what I heard. Is that what you're thinking too? And then maybe finally, I think the messy roles are the ones where you learn a lot. And for me, anyway, I got a lot more satisfaction out of trying to solve the messy problems. And I think that creates more value for the organization. If you're in a job where I take the requirements from this person and then I take them over here and I work with this group and then I bring back the exact thing, you're setting yourself up to be replaced. A lot of people can do that really vanilla job and you might get automated out of that job, especially in this day and age, right? So like having that ability to be a critical thinker, be curious and do the messy things, I think that's where you create value, you learn more, and you probably get more enjoyment out of it.
So it's ever present, I guess, in marketing, isn't it? The messy jobs, the messy roles. That's almost
Right.
all there is, it feels like.
Yeah. Probably because they all got automated out of the basic jobs, right?
There's probably a lot more messy roles here. I don't know how to compare it to other fields, I guess. Maybe others feel the same, but it's definitely the case in marketing. Yeah, that's so
Look,
true. The messiness here.
where does
Uh,
digital live?
yeah.
Right? Like I had a
Oh yeah.
digital role. Is digital part of IT? Is it part of marketing? Is it part of communications? Is it part of access? Is it part of strategy? Is it part of operations? Like, I mean, the reality is it touches all of those things. So it could theoretically live in any of those places. And it definitely like feels like there are a few more common homes, but it definitely feels like a lot of health systems put that in a lot of different places. And if you spend 15 years at a health system, which by the way, would be a shocking effort at this point. Like, I feel like that's not a real thing anymore. But anyway, if you did, you probably were put in more than one of those organizations during your career. You probably didn't always live in one place.
If you were speaking with younger Scott, first few years of your career, just kind of emerging, kind of getting to know things, first few years in healthcare, like what advice would you share? Just what would you point out, I guess, to younger Scott at that point? I'm really curious how you'd think of that.
Don't over index on tactics. Sometimes I think it's easy to be like, here's a tactic that we're going to try to use. So you go try to sell the tactic. You need to create the story, I think, more than the tactic. And by the way, as opposed to the tactic, by creating the story, you're thinking more about the journey and be open to iteration. Don't think you got to figure it out and your job is to go sell this. It's like the group on this tactic. It should be a conversation back and forth. Try to avoid marketese language. Like every industry has their shorthand and their terms and jargon. Medicine is, in my experience, at the top of that list of having the jargon between all the Latin phrases that the doctors want to use. As an aside, I was once told that ENT is not otolaryngology, it's otorhinolaryngology.
Oh
People
goodness.
shorthand it. I was like, okay, I mean, clearly it stuck with me. I can still remember it. But I mean, it's like we just have so much jargon, right? And acronyms. So where you can learn to speak your client's language is always important, and try to avoid using your own jargon. And then again, I think if you can bring some data to the conversation, right? Just bring those 1 to 2 slides instead of the 30. And that's really better, right? Like if I have a couple points of data and then I just want to have a conversation with you about it, you'll get further than trying to sell. I think maybe that's the advice. Don't try to sell the answer. Try to ask smart questions, be intellectually curious, get to the people that can make decisions and figure out how you can move the needle for them.
I remember going on a mini campaign at one point at a provider organization to say we're not going to use the word multidisciplinary anymore because it has lost all meaning. It only means something to you clinicians.
Right.
It doesn't mean anything to anybody else, and it literally means you are going to work with other clinicians to help the patient. I'm like, that's literally what that means. So anyway,
No,
funny
I remember that
story.
phase where that was like a big buzzword. And I'm like, I agree. I had the same thoughts. It's like you realize that the consumer already thinks that you're working with the other doctors. This is not revolutionary. In fact, if this is new, that's scary that you weren't working with the other doctors before. It sort of implies we've got this new, we're going to work together as a team. Like, really? You weren't before?
Yeah, you validated my campaign in my mind, so I appreciate that.
Yeah.
um, I wanted to ask you too, kind of related to that, as we were diving into the digital experience and things. Technology itself, specifically AI, when we're talking about how do we keep up, how do we learn about things? I've enjoyed asking people just how they approach learning about AI. To your point about like not having the answers or not even trying to sell the fact that you have all the answers. The learning approach that I'm learning from. I'm curious how you approach AI, like how you learn about it, or just how you feel about it in general, and if there are any particular tools. I don't even know how to ask this question, but it's just like how do you approach it, I guess.
I had a former senior executive at Northwestern ask me about finding a consultant to teach them AI. And I had to pause and think about that for a second. And my answer was, you shouldn't have someone teach you about AI. It's a fantastic tool to play with. I approach it with like curiosity, and I watch LinkedIn learning videos, and I found a few people and I subscribe to their feeds, and I regularly like will go do like a self-taught session to try to learn, break out some new aspect. But I think AI is amazing. Remove the potential environmental aspects to it. I go to AI for all kinds of things. I'm currently assisting a foundation, and they're setting up a net new entity. I can become just smart enough on so many topics. So the way I think about it is, it's not about productivity gains. Certainly there are those things, but it's about the ability to do something you couldn't do before, because you've got a partner that you can work with and get smart on. And then the other amazing thing is you spend a lot of time. Part of why we would do a 30-slide deck is because I was trying really hard to tell you something. But if I've got AI, I can build something and I can show you something. And I think being able to show instead of tell is an amazing revelation, right? And now we can iterate on the same thing because you can see kind of what my vision is. That answer I was trying to bring you earlier, I can bring it a little more to life much faster, and we can talk about it in more granular terms. It's hard to talk about AI though, because it's like you can do so much with it. What a time to be alive. I feel so corny, but like it is so different. It's game changing.
It is a truly unique time. It's the reality. It's what we're living through. So yeah, thanks. I think that's a great way to think about it. The show versus tell aspect of it all. I guess just anything else as you've looked back in your career, or any other insights that we just haven't touched on yet that you'd share with colleagues in healthcare marketing that we haven't talked about yet.
It's important if you're working at a health system or anywhere to find people that are outside of your discipline that you can go to and talk real with and get perspectives and bat around how to solve problems. For me, I had to have somebody in compliance that I could call and just work through a thorny issue with. You want somebody in access, you want somebody in legal, ideally, right? Like you want people in all these different other places because you're going to have to work with all these people, but also because they bring you different perspectives than your own. And that's another great way to use AI too, is to like tell AI to be this other thing, and then bat your idea around with it. But so having people outside of your chain of command that you can be radically honest with, I think is advice I would give to somebody. I would say don't be afraid of messy roles. Again, I think that they're more satisfying. Don't try to come with answers. Try to ask better questions. Bring your intellectual curiosity forward. Careers aren't like this linear line. And as a young person, I thought for sure like it was just going to be this progressive move in this one way. And I've really enjoyed my windy career. But even when I landed just in healthcare, it's kind of like a heart monitor, right? There's going to be blips, right? Both positive and up, so it's not just going to go like this. It's going to, you're going to have blips, and hopefully they are on a slope, but it's okay if they're not.
Scott, thanks for everything today. Thanks for giving us a look back, give us a lot to kind of help. And I feel encouraged by this conversation. Like I just feel like just knowing how things have progressed, the things you've been able to learn, the insights that have stuck with you, they just resonate in great ways. So thanks for joining us today. Best of luck with everything you've got going on.
Appreciate that. Thanks for having me.
And cut.